Just over 10 years ago, I boarded a plane in Turkey and landed in Accra. I had a suitcase in hand and an objective to meet lawyers, visit the marketplace, talk with some donors and other NGOs to find out whether or not DKT could make a difference in Ghana and to establish a legal entity there.
When Kwesi reached out to us, I was super excited because I love DKT Ghana. I was there right at the very beginning, and I'm so proud of the incredible strengths that DKT Ghana has gone on to in the last 10 years.
I happen to be the first employee for the DKT Ghana office. So I actually started with DKT Ghana on the 11th of August 2011. And I started off as the head of sales and distribution, so I had to build a team.
DKT International Ghana, a subsidiary of DKT International, is a non-profit social enterprise organization whose core mission is to contribute to raising modern contraceptives prevalence rates, reduce maternal mortality, and provide safe, quality options for HIV and AIDS prevention through dynamic social marketing.
We started DKT Sales in the year 2012 with 7 sales coordinators and 1 medical detailer.
DKT International started its operation in Ghana in 2012, providing safe, affordable, and effective choices of contraceptives and HIV prevention products and services. DKT makes its products available through pharmacies, chemical shops, private clinics, maternity homes, and hospitals across the country. The organization is currently the market leader in the distribution of Fiesta and Kiss condoms. It is also the proprietary owner of Lydia Contraceptives.
Some of the things that we did that people didn't know was how we even started selling, because the product wasn't known. We hadn't started any marketing campaigns, no activities, so the salespeople just had to go from outlet to outlet, putting products from 3 pieces to 6 pieces in outlets, just to make sure that the products were available in the outlet.
When we started, we faced some challenges where you enter an outlet, then you introduce yourself as you sell condoms, and people would just look at you. I quite remember one customer, when we entered the outlet, I introduced myself and then I just showed him the products that we sell. And then he jokingly said, "Ah, gentlemen, you are a wizard." And then I said, "Manager, why?" He said, "After I've gone to church on Sunday to go and pray to Almighty God to help me get money, you are here Monday morning coming to sell condoms to me." Now, he is one of our biggest buyers.
Then we moved on from how people had to accept only 3 pieces and 6 pieces onto their shelves to a pack, and then it moved on to a carton and all that. But even with that, we still had a few challenges because the product was new. It was on the shelf, but they weren't moving. But what did we do? Then we had the involvement of media agencies, and I think we worked with publicists then.
Communicating to our audience in very discreet ways was the biggest challenge. So we used things like bathroom cubicles, SMS campaigns, integrated products into movies, created a hit track with Sarkodie. And so there was a lot of different ways in which we worked on trying to communicate our message in a way that made people feel comfortable to receive the message. And I think that was the biggest challenge.
On a year-to-year basis, we kept increasing because people got to know us. We engaged a lot with consumers through all the means that are available to us, mass media, social media. Not as much at the time, it was more mass media and a lot of BTL activities as well. Found ourselves in a bit of a trouble with the regulators, right? So this was in 2016, moving into 2017. Yes, it brought us back to basics where we had to factor in all the necessary things we had to do as an organization to be ethical and to do the right thing. We had Mario come in after Kevin's tenure ended, who then was the 3rd country director for DKT. He brought in a lot of new things. I mean, it was a standard that we dropped numbers because we had already fallen foul of the law, so a lot of things had to change. Mario's time that we had to expand. It was also during his tenure that we had to move from only Ghana to cover Liberia and Sierra Leone. So At the moment, we have 3 offices, which is Ghana, Liberia, and Sierra Leone. Over the past 5 years, which is between 2017 and now, we've averted about 1.4 million unintended pregnancies, right? Live births that we've averted, 390,000. Abortions that we've averted, 830,000. When it comes to maternal deaths that we've averted, we've been able to avert about 1,200 maternal deaths, and child deaths as well. We've been able to avert 17,000 of them. For unsafe abortions that we've averted, there are about 480,000.
I have been following up on your results, and I have to say that I'm very proud. Under Kwesi's leadership, you did not only maintain but surpass 2021 results, and 2022 is looking even better. I believe what made you successful so far is your great sense of community, passion, and resilience as a country and as a team.
At this point as well, I would like to acknowledge a key partnership that we've had. This was prior to Mario's entry. We didn't have a very good relationship. Yes, the Ghana Health Services, the Ministry of Health, they knew what we were doing, but it wasn't as it was supposed to be.
Partnerships is a key building block of health systems. One of such partners is DKT International. These relationships have manifested themselves in the innovations that DKT, upon coming into the Ghanaian scene, has been able to actually contribute, especially in the lower levels of service delivery, that is at the sub-district and the community level. Helping to develop technical guidelines, helping to build the capacity of staff, and most of all, helping to make commodities available to fill in the unmet need for family planning services for the women of this country, has gradually contributed to reducing not only the number of women who would have died just due to unsafe abortions.
As a midwife, being in partnership with DKT Ghana International has really enhanced my job. In my 5 years experience with them, I've been able to have my IUD training, implant training, MVF training, and also self-injectables training.
Our outlet is one of the leading distributors of Fiesta, Kiss condoms, and Lydia range of contraceptives. Through the partnership, the regional community representatives, the RCRs, are assigned to educate people in our community, and they also refer them to buy from us. Through the training organized by DKT, we've gained in-depth knowledge on all the DKT range of products, and we are able to give the counseling of the product to our customers.
DKT has supported women's health. They have improved access to family planning services, particularly in the urban areas and also in the private sector of our country.
A lot of things that we do currently, we can continue to do, but if we get to get the donor support, then we will be able to scale and do even more. The future will now be one of the things we've started, which is trying to be a part of the fabric of society, and which we started with the agenda boreholes for some communities.
In line with DKT's values and contributing to the achievement of Sustainable Development Goals 3 and 6, the organization is providing potable water to 5 deprived communities in Central, Upper West, Bono East, Oti, and Western North regions to commemorate 10 years of operating in Ghana. 2 of the water projects have already been commissioned at Konda Junction and Adonkwanta of Karachi East Municipal and Bia West District in the Oti and Western North regions. Konda Junction is a small farming community with a population estimated at 600 in the Karachi East Municipal of the Oti region. Prior to DKT's intervention, the community did not have access to potable water. They consumed water from the Abomba Kwejo stream at the far end of the community.
We chose to do a water project for our 10th-year anniversary because going round, we've realized that people would need to live, and water is one of the things that would give them access to a good life.
Yes, this is DKT, and the whole organization, we donate this to the Konda Junction community, and just as we we believe that you will take good care of the place so that we will continue to have access to potable drinking water. So on behalf of the entire organization, here you go.
The issue of potable water is a major concern to us as an assembly. So the coming in of DKT to support through the provision of mechanized borehole facility for this community. Indeed, the community were without potable water. And if you were to go to the source where they fetch, one will appreciate the coming of DKT to this community.
They used to come to the facility with abnormal pains and typhoid fever most due to the intake of the stream water.
First, no need to be bread. A best sorry, and I do over 1 yen tama over sense you have an answer moon. DKT. Since you're not my baby,
It's a very beautiful anniversary to celebrate, but if you really look at what we've done in the past 10 years, we are very proud of our achievements, and we are proud of the future that we see ahead of us. We know that with the partnerships that we've been able to chalk over the period, which includes partnerships with the Dutch Embassy, the USAID at a point, and then these donors that are not present in Ghana, like the SIF, like SIDA, and the large anonymous donors. Partnerships with them would help us continue to do what we do and at scale.
One of my happiest moments after I left was when Kwesi got the country director position. I knew he was perfect for the job, and so far, he has surpassed any expectations. However, I look forward to more leaders coming out of AWA in the near future. You are a very talented team, and you have to contribute so much to DKT. Have a fantastic 10-year anniversary.
Here we are 10 years later, and it's pretty remarkable and incredible to think that DKT is one of the premier organizations in Ghana, perhaps the largest in terms of the work that we're doing in reproductive health, and that we've expanded now to Sierra Leone and Liberia. Just imagine the impact that we're having in such a short amount of time. Our brands are strong. We've got an amazing team on the ground. We have the trust of donors, the respect of the government, partners and NGO partners, and most of all, happy consumers whose lives are being changed and affected every day by the work that you all do. So I take my hat off to all of you in Ghana, in Sierra Leone, in Liberia. I can only imagine what the next 10 years is going to be like, and I can't wait to see what happens. Enjoy your celebration, and all the best from Washington, D.C.
The entire DKT Ghana team should be very, very proud of their accomplishments, not just in terms of the distribution of products, or in terms of lives changed, or in terms of the health impact to the nation of Ghana. On behalf of other members of the Anglophone West Africa, I'd like to congratulate the DKT Ghana team on this huge milestone of attaining 10 years.
On behalf of myself, the Family Health Division of the Ghana Health Service, to congratulate the staff, the management, and all other collaborators of DKT for this great achievement.
I want to use this opportunity to congratulate DKT on their 10th anniversary being in Ghana. We hope that the next decade will even be more success for DKT, and also improving access to health for women, adolescents across the country.
Congratulations, Kwesi. I'm super proud of you.
We wouldn't be here without the team. This is a very vibrant team we have, but they have done tremendously well, and I want to use this opportunity to say a big thank you to them, congratulate them for the feats we've achieved over the past years, but then they all understand that that's history. We've jubilated over those. What's the way forward? And I believe in their capabilities and their strengths, that as a team we can do this and do it even better.